You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what every denture wearer needs to know. With as little as 2 dental implants, according to this expert, they can get something that snaps in and snaps out, no more adhesive. With us, we have board-certified oral and maxillofacial surgeon, Dr. Broumand. Dr. Broumand, welcome to the program.
Thank you.
Thanks for coming on. Now, for people that don't know, we had your partner, Dr. Akers, one of the senior partners. What is your role there, by the way?
Well, my role is pretty much very similar to what Dr. Akers does. You know, we're all board-certified oral maxillofacial surgeons, and we all specialize in reconstruction of people's faces, whether it's including cosmetic surgery, trauma surgery, cancer surgery, and more importantly, and actually most importantly to what most of our patients come in for, are dental implants, because it really does change their lives in a manner which it really can't be described.
Are people afraid of oral surgeons especially, aren't they?
You know,
do they tell you that? I don't like going.
Luckily, I haven't had that, and I think it's because I always got a smile when I go in the patient's rooms, and I try to make them feel comfortable, because you know what? You know, there was a time where dental implants, you know, had to be placed underneath the jawbone and underneath the gums, where they would actually open up your gums, put this thing in the bone, and hammer it in place. And those things were called subperiosteal implants. We don't even place those anymore. I've taken out so many in my career. Now dental implants are so easy, so painless. Actually, most patients don't even require pain medications anymore.
Is that right?
Absolutely. It's become so easy. It's actually not challenging anymore. It's almost fun.
Is that right? It's fun.
It's fun. It's more fun for the patients, because they come in and they leave my office, they can't even believe they had surgery.
Really?
Absolutely.
So are they sedated during the process?
They can be. You know, fortunately for most of our patients, they come in. Sometimes they have an anxiety level, because your mouth is such an important part of your face, and you know there's nerve endings there, so people think there might be pain involved. But once they go through the whole procedure, they realize they don't even have to be sedated. You know, patients come in and they rely on our medical training and our training in the hospital and anesthesia that we get, and they ask us to put them to sleep. So we do that for them a lot of times, just for them to be comfortable. But when they realize that they've gone through a procedure that actually removing the teeth was harder on them than placing the implants in the past.
So 70, 80s, not too old to get
not at all
fixed.
I have to tell you, we've had patients in our practice that are in their 90s. I think my partner actually placed implants on a patient that was 100 years old. My patients come in and they often tell me, they say, well, I'm kind of too old for this. And I tell them, actually, you know what? You're not.